Hi everyone, welcome to today's COVID-19 update for Yakima County. My name is Jocelyn Castillo, Community Health Specialist at the Yakima Health District. Today I am joined by a couple of guests from Yakima Valley Farm Workers Clinic. We have Chief Medical Officer Kevin Heydrich and Lori Kelly, Senior Director of Quality, and they'll be providing a quick update from their clinic as well as answering some questions about the COVID-19 vaccine and sharing other important information on staying healthy. Thank you both for joining us today. We'll be hearing from them shortly. To start, I'll share our current numbers. As of yesterday, we have reached a total of 20,412 cases of COVID-19. Yesterday, we also reported 70 individuals who are currently hospitalized due to COVID-19. 5 individuals are currently intubated, and the number of deaths due to COVID-19 has also increased to 294. Unfortunately, this week we are seeing a record high hospitalizations. On Monday, we reported our highest number ever of current hospitalizations at 66. And as you just heard, that number has now climbed to 70 as of yesterday. During our peak in the summer, the highest number we reported for current hospitalizations was 61. And sadly, we have surpassed that now. I just want to remind everyone that these are our family members, friends, and neighbors that are getting infected and becoming severely sick from the virus. And it is still in our control to help reduce the spread of COVID-19 in our community. For other updates, today Governor Inslee announced current restrictions on indoor gatherings and certain businesses and activities are going to be extended until January 11th. Previously, those restrictions were in place until January 4th, but given the continued increase in cases and hospitalizations that we are seeing statewide, those restrictions have now been extended. Last week, the Yakima Health District was also notified of an outbreak at Costco, and in an effort to be more transparent about this issue, we sent out a press release yesterday with the latest information regarding the situation. We're continuing to work with Costco and their staff to determine the source of the outbreak and help contain the spread of the outbreak. We will continue to monitor the situation and provide updates to the community as needed. I will go ahead and link yesterday's press release to the comments section of this post as well. For this week, if you attended a large gathering for Christmas, we urge you not to gather with others for New Year's. The current guidelines do not recommend indoor gatherings unless you have quarantined for 14 days before the gathering, or if you quarantine 7 days and for 7 days and receive a negative COVID-19 test result before the gathering. And given the short amount of time between these two holidays, if you gathered with others during Christmas, it's best to avoid gathering with others for New Year's. Even if you feel fine, you may still have the virus and unknowingly pass it on to others, including vulnerable individuals who may get severely sick or suffer severe complications if infected by COVID-19. We understand that quality time with our loved ones is precious, but at this time, gatherings increase the risk of COVID-19 spreading. Even if you stay home, there are still fun ways to celebrate. Consider supporting local businesses at this time by ordering in a special meal for your family, or plan an outdoor activity such as hiking or sledding, or it's also a perfect time to work on those New Year resolutions. And while it is safest to avoid gatherings, if you do choose to gather with others outside your household, please do so wisely. Keep the gathering small. Remember to wear a mask and practice social distancing. If you are notified of a potential exposure to the virus after the gathering, please quarantine and get tested. And just as a final update, Yakima County continues to receive additional doses of the COVID-19 vaccine. As of today, we have received a total of 4,450 doses of the Pfizer and Moderna vaccines. Currently, due to the limited supply of the vaccine, distribution is being conducted in phases. Right now, we are in the first phase of distribution, also called phase 1. And so during this phase, only healthcare workers and residents and personnel of long-term facilities will be receiving the vaccine. And now we'll hear from our guests from Yakima Valley Farm Workers Clinic. They'll start us off with a quick update from their clinic.
Of course. Thank you for having us today. We really appreciate opportunities to come and update the county on what Yakima Valley Farm Workers Clinic is doing around COVID-19. And as we've said from the beginning, it's always our response to keep our communities and our staff safe while we continue to provide health care and well care to every one of our patients and to our community.
Thank you, Lori. So I guess we'll dive in now into some of the frequently asked questions we've received from the community on the COVID-19 vaccine. So one of the questions we get is, how do the vaccines work?
Oh, Kevin.
Yeah, so both the Pfizer and the Moderna COVID-19 vaccines are a new vaccine technology which uses what's called mRNA, which is a messenger nucleic acid, which when injected enters the cells and stimulates those cells to produce a fragment of the actual COVID-19 virus, which is the spike protein. That spike protein then elicits an immune response from our own body, which is what is protective against the infection should you actually be infected with the virus itself. It should be known that the mRNA does not ever, there's a concern that people have raised that does it enter the nucleus of the cell? Does it cause potential modifications to our own genetics? And the answer to that is no. It is something that stays in the outside portion of the cell and just helps manufacture that spike protein, which then elicits the immune response, which is protective. So it's a very novel vaccine, new technology, and has proven very effective to date in the clinical trials.
Mm-hmm. Thank you, Kevin, for that information. So another question is, are healthcare providers needing to be trained on how to administer the vaccine?
I can take that question, Jocelyn. Our healthcare providers do not need to be trained on how to administer the vaccine. They are both new vaccines, and so there is some degree of uniqueness to each of them, and so we do need to train on those particular vaccines, but not on the administration. These are standard intramuscular injections that we're administering, but like I said, we are training our staff regarding the vaccine itself and the unique properties that go with that particular vaccine.
Thank you, Lori. And then, is the vaccine safe for everyone?
So generally, yes, the vaccine trials have proven that it is very safe for everyone. There is limited data, and currently both vaccines do not support or do not make any recommendations in regards to pregnant women or breastfeeding women because those patient populations were not studied in the vaccine trials, nor were they studied in patients less than 16 years of age. So they're not recommended for children at this point. The only significant adverse effect that I'm sure people have heard is the potential for an acute anaphylactic reaction, which is an allergic reaction, but that appears to only occur in people who have a history of that type of anaphylactic reaction. So that's a precaution and a potential contraindication to the vaccination. But other than that, the vaccines appear very safe.
Yes, I would add on that we have at this point vaccinated about 160 of our frontline staff, and we've not had any significant reactions whatsoever.
That's good news. And then we also know that some community members are wondering if they'll be fully protected against the virus once they get the vaccine.
So when we talk about protection, it's a term we use, which is called efficacy. How effective is that vaccine in protecting someone from the infection? Both the Moderna and the Pfizer vaccines appear to provide approximately 90 to 95% effectiveness against the COVID-19 infection, which is very, very high compared to many other vaccines. Even our annual flu vaccines do not provide that type of protection against influenza.
I think it would be important too to discuss that people do not have full immunity after the first vaccine. I think that's a common follow-up question to this, to the efficacy. So there's a percentage of 60 to 70% effective after vaccine 1, but it's not until 2 weeks after the second vaccine that you really reach that full protection.
Thank you. And then are there other treatments for COVID-19? I know that we have received a couple of questions on ivermectin. I'm not sure if I'm pronouncing that correctly, but whether that can be used for treating COVID-19.
So in the outpatient setting, so people who aren't sick enough to be hospitalized, generally the treatment is supportive, as you would for any viral infection. I know some primary care practitioners are prescribing steroids. People have heard of the dexamethasone being used for hospitalizations. And really it is recommended only for hospitalized patients, though some people are using it in the outpatient setting. One other potential treatment for the outpatient setting are some monoclonal antibody treatments. And let me get the right name for this, bamlanivimab, which is a monoclonal antibody treatment, which is for people who are almost sick enough to be in the hospital but not quite there. It can be done as an outpatient intravenous infusion, and it is offered in some of our local community hospital centers. It's not something that we're doing in the clinic, but it's available in the community. Ivermectin is an antiparasitic drug. It has shown some effectiveness in what we call in vitro, which means in a test tube. And there's some studies going on to look at this, but it is not an approved therapy at this time. So in the outpatient world, there's very limited treatment options. In the inpatient world, there are some treatments. We've all heard of remdesivir, which is an antiviral medication, the dexamethasone, which I already alluded to, which is a steroid, and there are some antibody cocktails that are being given in the inpatient setting.
Thank you, Kevin. And then we also know, unfortunately, that many of the deaths that have occurred due to COVID-19 have been among people with underlying health conditions. Do you have any advice or recommendations for how individuals with those health conditions can stay healthy at this time?
Sure, absolutely. I can take that one. You know, at Farm Workers, we see patients every day with chronic illness, and we really encourage patients to continue to seek their well care, continue to be in contact with their primary care providers, taking medications as instructed and calling the clinic if they don't understand the instructions. Certainly we want to make every effort possible to make sure that we are able to get medications to patients safely. If patients do feel that they are becoming sick, even if their symptoms are minor, we want them to call the clinic. We want to make sure that early intervention, that we're intervening early and keeping people more healthy. And of course, you wouldn't be having a call with me without me saying, wear your mask, socially distance, don't have gatherings in your home. Even when you're going out to the supermarket, you know, making sure that you wipe off the cart and you use hand sanitizer is important. So it's really critical that we all engage in our own healthcare right now and follow these tips to keep ourselves healthy.
Yeah, and I would add to that people who have significant risk factors, obesity, diabetes, any other underlying significant chronic healthcare condition, especially pulmonary conditions, you really need to keep your social bubble incredibly small to, I would even say, non-existent. Stay home, stay safe until it's your turn to get vaccinated and gain that protection from the vaccination. Everybody you interact with, you're potentially interacting with everybody they interact with because you don't know what all their exposures are. So the less social interaction, although it is incredibly hard, especially during these holiday seasons in which you mentioned earlier, is so paramount that we protect our vulnerable people.
Right. Well, thank you again, both Lori and Kevin, for joining us today and providing some answers to these questions and providing other information as well. With that, I want to thank everyone for watching and wish you a very happy new year. We know that this has been a difficult year for everyone and that many of us are looking forward to the end of 2020. 2021 brings hope of the end of the pandemic with a vaccine. But it will take some time for the vaccine to become widely available to everyone. So in the meantime, we must all continue to do the things that we can do to stop the spread. And that includes wearing a mask, staying 6 feet apart, avoiding gatherings, and practicing good hygiene. Thank you for watching.